So I've had great training here and I've really enjoyed sort of the time I've spent at Cardiff and Wales. But partly just fancying a change of scenery. I have every intention of sort of returning in the future, but I think it's quite important early on in your training that you experience sort of lots of new places and how different hospitals run. So in my placements in Cardiff, I've been sort of based in normally sort of small district general hospitals all throughout the country, and it's been very good and I've really enjoyed it. But I think I'd like to try sort of a big university teaching hospital as well, so that's where I'll be heading in Liverpool, and hopefully sort of the more training I can get in now will stand me in good stead for the future.
In terms of your colleagues, what's their position, the people you'll be graduating with? Are they all looking to move out of Wales for their foundation years, or is there a mixture? It's
a mixture really. People who are choosing to move outside of Wales are either attracted sort of by the bright lights of London and the big cities, or they're just moving home to where their families are originally from. But I think about 2/3 of my current year group are remaining in Wales, which is really good to see. And that's just because I think, again, the fantastic placements we've had, everyone's incredibly friendly and supportive here. And your foundation sort of training years are quite a terrifying time. It's a big change for medical school, so I think people feel quite safe in remaining here and being in hospitals that they're already familiar with, and that's just sort of takes part of the sort of the fear away then. I think it sort of decreases in sort of popularity the further down the line you go. I think people are just attracted to sort of the big cities, the big specialist centres, and Wales doesn't really have many of those. Obviously, at the University Hospital of Wales here in Cardiff, but that's really it in terms of big specialist centres. I think people are a bit wary of sort of going to train in smaller hospitals with the rotas and more sort of they'll be spending a lot more time on call. There's possibly less dedicated time to teaching, so I think that would put people off. I think they'd like to be concentrated in sort of hubs where there's lots of specialist activities going on, because I think we perceive that that's better training for us then, and allows us to sort of treat the patients as we think they should be treated. Sort of somewhere that offers the sort of training scheme that I want, and a specialty that I'm interested in, again, which could lead me all over the UK, but somewhere where I can sort of be sure that I will be having dedicated time away from sort of clinical work to do research, is something which I'm interested in, but also just to sort of have that time to study for the specialist exams that we have to do through medicine, and to just be sort of just so that I know that I won't be sort of worked to the bone completely, that I'll have a good number of sort of on-call shifts, and that's not what I'll be, something that I won't have to worry about as much, because it's good to have that teaching time as well as it is to have sort of shifts on call. You learn through both sort of things, but it's good to have a good balance of those rather than one or the other. So definitely dedicated teaching time will be a big sort of factor.
Do you think that Wales offers that level of protected teaching time and study time and research time at the moment?
Speaking for sort of protected teaching time, what I've heard in terms of sort of Professor Derek Gallen, what he's been saying about sort of the thoughts in the South Wales programme, and how sort of we need to change to get more specialist centres and less sort of smaller outlying centres, it makes me think that there isn't as much dedicated teaching time as there should be at the moment. So I don't think Wales is offering that currently, but hopefully with sort of the South Wales programme, and I know it's a hard decision to make, but in terms of if there are more concentrated centres, then the specialists will be in fewer places and can then in their rotas incorporate protected time for teaching and studying. That's sort of that's the most obvious thing that will attract a lot of people, I think. There's obviously other things where, Wales is a huge area and people are not really aware of what's going on in sort of smaller parts and sort of only see Cardiff and Swansea as such. But I think that will go a long way in sort of, persuading people to come here, because it's the specialist centres that people go for in England. So, I don't see why people wouldn't go for the specialist centres here in Wales then, if that's what, were created.